Welcome to The Dot, the podcast that aims to bring you closer to the heart of healthcare. I'm your host, Josh Messersmith, with Jenna Smalley, and in each episode, we'll be diving deep into the world of Wyandot Memorial Hospital, exploring the incredible services we provide to our community. Join us as we connect with our dedicated medical providers who work day in and day out to ensure the community's well-being. From doctors and nurses to specialists and therapists, we'll bring you insightful conversations that shed light on the outstanding care available at our local hospital. Today, we are thrilled to have two exceptional guests from Wyandot Memorial Hospital. First, we have Bair, who is dually certified as a nurse midwife and a women's health practitioner. Megan provides a wide variety of services for women, including contraception and family planning, prenatal and postnatal care, and gynecological exams, treatments, and procedures. Joining her today is Susan Hotelling, a certified nurse midwife who also provides a variety of gynecological and OB services for women. Susan's dedication to women's health has helped countless individuals navigate their wellness journey, empowering them to take control of their well-being. Together, we'll unravel the complexities of modern medicine, demystify procedures and treatments, and educate ourselves on the latest in medical advancements. Whether it's discussing cutting-edge technologies or the importance of preventative care, The Dot is here to empower you with the knowledge that we can make a real difference in your life. So grab a cup of coffee, sit back, and tune in as we embark on this journey to explore the world of Wyandot Memorial.
Welcome to the show now. We're diving deep. Your health and the wellness in your hands to keep. Tips and tricks to know now. Stories that inspire. Living life with knowledge. Set your mind on fire. Tune into The Dot. Health from head to toe, together we'll unlock the secrets you should know.
Megan and Susan, thank you so much for coming today and being on this new adventure that we have here at the hospital. We appreciate you taking time out of your day to come here and talk about women's health in general, demystify some of the misconceptions that maybe happen with preventative care and in annual visits. And we look forward to learning much more about women's health. So the first question I have is, we'd like to know your why. Why did you choose women's health? Why is that important to you? And then why also Wyandot? Megan, you've been here 6 years. Susan, over 30. Mm-hmm. What brought you to Wyandot and what made you want to stay? Susan, we'll start with you.
Well, I live locally. So when I started working here, I was a nurse on med-surg, and then I ended up being an OB nurse, and then they were looking for someone to be a midwife, and Phil Smith was the only OBGYN at the time, so he approached me about going back to school. So the hospital was very supportive, and the rest is history.
And so we were talking a little bit before this too. So Megan, you had a connection with Susan before. So you did your training with Susan.
Right. So when I was in high school, we had an opportunity to do job shadowing. And so I spent one of my days job shadowing with Susan. At the time I knew nursing. I figured I would do some sort of nursing. And then I followed her and I was like, actually, that's what I want to do. I want to be a midwife. And then when I was going through midwifery school, Susan did take me on as a student as well and did some of my mentorship under Susan. She's still one of my biggest mentors. If I have questions, Susan.
Back and forth.
Yep.
I love that. I mean, it's really great that, especially as Jenna and I are going through this process with other providers at the hospital, we're seeing that there are so many of those connections that people have started in the hospital in one department or specialty, and they've moved through and they've had that connection with the community and with the staff for quite some time. So it's nice to hear that again. Yeah. I'm surprised to hear that is, what's common here.
Yeah.
But it's great to hear, and it's great to see every day.
Yeah, I would say a lot of times for Susan and I, if there's a patient that maybe we have a question on, or maybe what's the next best step for her, where do you have a resource for where we should send her for this test? Or, what dermatologist do you love? Or anytime we are throwing something around, it's very back and forth, open telephone line. We talk a lot.
Mm-hmm. And we've both had an opportunity to work outside of Wyandot Memorial Hospital. Megan worked somewhere before, right after she graduated. And a few years ago, I worked at St. Anne's in Columbus, just on weekends to get, a different experience. And we both can bring some of those experiences back here, which is really important when you're in a small hospital.
Megan, would you be able to go in a little bit more depth about your why? So you talked about shadowing with Susan, getting the experience there when you were 15 in high school. But what then is your why that brings you back every day for your patients?
I really enjoy being part of the community, like serving the women in the community that I live. I think that it's really something special to be able to have a relationship with people, not just in and out of the hospital, but it gives them a level of comfort that, hey, I know this person. It's a friendly face, or someone that I know and love and trust has also been to her and said they had a safe, good experience. And I think that that adds something, being local and creating those connections and those relationships.
It's almost and Susan, you probably have a better understanding of it since you've been in, the community your whole life. It's almost like a double-edged sword, because yes, we're going to give you, we know you, we trust you, we're going to come to you and bring our care. But also when I have a bad experience, I'm going to tell you about it, and I'm going to see you at Walmart, and I'm going to see you at Kroger.
Yeah.
So it's almost like we have to, and I say this all the time when I'm talking with people who aren't from around here, we almost have to provide a higher level of care, because no matter what, most of us here live in this community, and our community loves to tell us about their experience here, whether it's positive or negative, which is good for us to have that direct pulse on what's happening in the community. But it's definitely, like I said, a double-edged sword, because you never sometimes know what you're going to get.
Yeah, I think it's something that we can be prideful of, because Susan and I have both been, like, I'll see a post on Facebook about looking for a new OB, who's everybody going to, or a new GYN provider. And I would say Susan and I, both of our names come up a lot in those threads, and it's reassuring, and it feels good that our community trusts us with their care.
And it's nice to come into a room and it's not just a name on a chart that you don't know. It's someone that you just saw in the grocery store last week, or it's someone that you've ran into at an event in your town. And the majority of my patients, and I think you would agree, Megan, we know them. We know their families. So I think that's such a benefit compared to people that work in a big city that see people in an office, see a chart, see a name, never see that person again, and really don't have a bond. And they also may be seeing a patient one visit, and just how the schedule rolls, they may never see that patient again in a big practice. And we luckily have a different setup here altogether.
Yeah, I think it increases your sense of accountability and responsibility. For that patient.
I agree. It's personal.
Okay, I want to talk a little bit about misconceptions. So what are some common misconceptions about preventative screenings, and how can we address these myths to encourage more proactive health management among women? Megan, if you want to start with that, we'll have Susan piggyback off of it.
One thing I always try to clarify with women, especially when they're coming for their annual exams, we don't necessarily have to do a pap smear every year. And Susan is the same way. We like to educate people and let them know what's going on with your health. What are the expectations of the visit today? And historically, you did a pap every year. And with some of the differences in screening guidelines now, we don't necessarily do a pap every year. But women assume that a pelvic exam includes a pap smear. And so sometimes it's just educating, like I might do a pelvic exam today just to make sure the tissue is healthy and to make sure are you having any pain? Is there any concerns that you have? But that doesn't necessarily mean I'm going to be collecting a pap smear. And so making that a clear difference to them, that's a different experience. What I'm doing is not a pap smear, but we're still doing a screening tool. It's still something that's important for you to have done. It's part of a preventative exam.
Susan, what kind of misconceptions would you like to address?
I think sometimes when people are looking up someone to take care of them for their needs, and they see the word midwife, and they think Megan and I just deliver babies at home, that's what a midwife is. And they don't realize that we provide full scope care for all of women's needs.
Which is nice, because my next question was, how do you go about picking a provider? When I look at the list of primary care providers, is it random, or is it similar to like our mental health professionals we're talking about? It's a process. So you can start with Megan, and maybe Megan wasn't the exact provider that the patient was looking for. And so it's great that you can refer to Susan. Is that common when you're picking a provider to maybe not land on your final one first?
I think so. I mean, just like any other specialty, any other provider, there's going to be personalities that have a play in it. And there's conversation that's happening. No one wants to sit in a silent room during their pelvic exam. And so maybe that's not what they prefer. They want silence, and they don't want someone conversing with them. Or, maybe it's a difference in they had a paper gown and I wanted to be in a cloth gown. I wanted to be in a real gown, or a paper drape made them uncomfortable. Or, there's just, everyone has a different preference for what that experience is going to look like. And I think it's really, really important that you are extremely comfortable with your provider, because you're in that office maybe only one time a year. You need to be able to ask the questions questions that need answered, and you need to be comfortable to seek that answer. Because if you're not comfortable there, when are you ever going to get that information?
Yeah, and I do believe the nice thing about Megan and I, we practice very similar. So if a person chooses her for her personality, or they choose me because someone referred them to me, it's not like they're really getting a different type of care. We practice very similar. And Dr. Doty, who's in our office also, she also, does things very similar to us.
So as we're talking about similarities and the continuous care and the quality of care that we give, Susan, would you talk a little bit about your recent transition to Cary and what that means to, you started in Cary, correct?
Yeah. Years ago, there was an office in Cary in the old Progressor Times building. Dr. Farmer was practicing family practice at that time. And there was some changes in, I believe it was physician assistants rules and regulations of how they could practice. And there was a coverage issue, and the politics, it didn't work out. So I had also practiced at Sycamore Medical at one time, and then back at Upper, different practices for periods of time, and now back in Cary. And it is lovely there. They have a pharmacy, and our pharmacy is booming. They have really nice staff there that people seem to be really happy with. The lab is available. They have great lab hours, which has been working out great with the public. I love being able to have my patient seen and go right out and get their labs drawn. I was afraid that, they would all have to go back to Upper, and that's not always convenient for everyone. Dr. Puckett seems very happy downstairs, and his wife, Jamie, has been making sure everybody's happy. She's the office manager, and Dr. Harris is upstairs with me on the second floor, and they are booming.
And I think, and within our strategic plan, one of our initiatives was to meet our patients where they're at. And so by putting up that brick and mortar facility in Cary, in the downtown, that is truly making a difference and impacting patients is key. And being able to bring those women's health services to our patients, not saying that the drive to Upper is too long, but being able to maybe reach a different demographic that is in Cary or in that region. Because I think the thing that we always struggle with, and this is across the board, is how do we accommodate those patients that work 9 to 5 or that don't have a day off till the weekend or work nights? How do we address that? And by meeting our patients where they are, I think in opening these other offices off of our main site here is key to being able to do that. So that being said, can both of you talk a little bit about how you accommodate the average consumer or average patient within our community? So what kind of after hours or weekend hours do we offer?
At Cary, we start the morning at 7 o'clock in the morning. And that works out great for a lot of people that can't really miss work, but can pop in before their day starts. We have a late day that we're there till 5:30. Dr. Harris, I believe, has a day that's even later, and Dr. Puckett also does. So we can bring people in that can't get off work.
And then you do offer a late night a month?
Tuesdays
are late.
Every Tuesday we stay late.
And then Megan, you do like a weekend,
right?
a Saturday.
Saturday, the first Saturday of the month, we have scheduled women that come in during that time too. Like if you don't want to take off a day during the week, and then you can come in on that Saturday. We also offer walk-ins. And so people that, like, oh gosh, it's Saturday morning, think I'm getting a urinary tract infection, I'm just going to pop in there and, get that test run. So we do have some walk-ins that will come in on the first Saturday as well. And then we start at 7, 2 days a week, Wednesday and Thursdays. And Monday night is our late night at the Wyandot office in Upper.
And then one of the initiatives that we do here at the hospital too is Ma'am Day. So where we're able to bring, and I want you guys to talk about it a little more, because again, I know high level about it. I don't know what all entails within the Ma'am Day festivities that we have here. But that's on October 14th this year from 7 a.m. till 6 p.m. And then we're doing the free clinical breast exams in our Cary office with Susan. So Megan, will you talk a little bit about Ma'am Day?
Yeah, we've done Ma'am Day for a few years now, and it's always a really great experience. It's fun to see the women come in. We do offer free clinical breast exams that are just walk in. You don't have to make an appointment ahead of time. And even if it's not time for your annual to be due yet, if you're like, man, I've just had this question, or I just have anxiety about this, and it's something I just would like to have done for reassurance, we do free clinical breast exams on Ma'am Day. We also have walk-in availability for mammograms. So if you're due for your mammogram and you have an insurance plan and they cover an annual mammogram, even if you aren't scheduled, you can just walk in that day and get your screening mammogram. If you come to us for a clinical breast exam and we find something that's abnormal, we may not be able to do the mammogram that day just because we want to make sure we have a radiologist there so that we can properly address that. But say you don't have insurance or your insurance doesn't cover mammograms, maybe you have like a catastrophic insurance plan that doesn't cover preventative care. We do have a program that we team up with, BCCP, and they offer reimbursement to the client. So they cover the mammogram, they cover an annual exam in our office, and they also cover a screening pap smear. So a lot of women, if they come in and they don't have insurance or their insurance isn't great, we will connect them with BCCP. It's a great program that our county offers, and we get their mammogram covered.
And we can have that all set up the day that you come in.
Yep.
The BCCP.
That's a great point. And that's what I was going to ask is how does the average person who maybe is underinsured or non-insured, how do they know about these programs? Who do they contact here to be able to get enrolled in those or know that that's an option?
They can reach directly out to our offices.
Yeah,
and we'll take care of getting it all set up for them.
Brittany Till is the Women's Health Navigator. So if there's a question that maybe Susan or I can't answer publicly, or like if somebody comes up and just casually asks us a question, then Brittany Till is the one that would organize that on the back end. Kaylee Arthur is also really great about answering and connecting people with the BCCP program. She works pretty closely with the ladies that run that program. And, you know, we have a lot of options or like flyers in our office, which isn't helpful if you're not in the office to see them, but we do try to advertise for those things. And I know that the Wyandot Facebook page does a pretty good job of notifying of the MAM Day, and we have signs around town and hopefully word of mouth.
It's kind of what we're hoping to with this podcast is getting this out before MAM Day so people can hear it and they can start to know, oh, I can plan, or I can start to, you know, I may not have insurance, but I can definitely still come and get a mammogram.
Your own breast exam is always nerve-wracking. Am I feeling something? Am I not feeling something? Is this normal? And so if you're having concerns, that's a great time to stop in and we can go over how to do a self-breast exam, not only us doing a breast exam on you, but teaching you how to do your own. The majority of our breast tissue is fat and lumpy, and it's hard to feel what's something to be concerned about. So that gives us a chance to have some personal time one-on-one with you to go over any sort of needs or concerns that you have.
I think it's helpful to give women an opportunity to feel reassured, if nothing else. I try to counsel women, like, if you're stressing about something and you're not in a place where you're going to do something about it, there's no momentum in that. The reassurance of just getting the test done and knowing that you have an answer, maybe it's not a positive answer. Maybe your screening didn't come back negative and we need to do a biopsy, or it entails further treatment, but you know there's an actionable step that we can take at that point so that we know what's coming next. It's like one of the women that I was talking to said, anxiety is like trying to get somewhere fast in a rocking chair. You just sit in it. You never really make forward movement in it. And that's how I feel about these screenings. Yeah, it can be really nerve-wracking and you can be anxious about the results, but we want you to come in and have the screening done because then we can take a step. We know the next step. We can guide you into what that's going to look like.
And that has to be the importance. You know, everybody always says if you get the test and you can catch it early, or everyone's always afraid of cancer or some type of life-changing disease. If you're doing those preventative screenings and you catch it early, there are processes and opportunities to truly take back your life and not be defined by one bad screening.
Right. You want to catch things early when it's like very, very tiny, because you're not dying of breast cancer because you have breast cancer in your breast. You die because it has spread into other organs. So by the time you can feel it, it's already a certain size. So getting your mammograms is going to catch it significantly earlier when it could make a huge difference in your outcome.
What is the required age to receive a mammogram?
We do a baseline, one-time baseline between the age of 35 and 40, and that's a one-time baseline. And then after the age of 40, you get one every year annually. And then every year after that, after the age 40, they're going to look at your films and they're going to compare that back to that one that they did between 35 and 40 to look at that breast and say, okay, well, this is what her baseline looked like, and now let's look how she's changed. And was that there before? And, you know, this is how she looks now. And after you're 40 years old, you actually can order your mammogram yourself. You can call and schedule it and just make sure you list who your provider is so then we can get the results. And your family doctors like to have those results too. You can always list more than one person.
Is there any tips to do if you have family history of breast cancer? Do you guys recommend screening prior to that age?
Yes, there are some guidelines about starting screening early if you know the age of the diagnosis of the person, and depending on what your age is. But a lot of times they'll want scans started way ahead of time if you have a close family member with breast cancer.
There's a screening tool that the radiology department uses that runs well along into the gynecology world. It's called a Tyrer-Kruzik score, and it takes into account your current age, any breast history that you have, the history of your mom, of your grandma, of your aunts, if there's any female relatives in your family, if they have had breast cancer or they've had biopsies or they've had, dense tissue. Density plays a big role in that too. If you have extremely dense breasts, sometimes it's hard to catch things on mammogram that the radiologist may say, this tissue is really hard, that we think actually you're going to be better suited for an MRI so that we can correctly screen your breast tissue for cancer. And so it's nice to be able to have that flexibility. And a lot of times using that assessment, that Tyrer-Kruzik score, will help us justify to insurance plans, nope, she needs an MRI. She needs a breast MRI because this screening isn't ideal for her. And that's all just part of the conversation when you're talking about breast screenings.
You do have to start with that basic mammogram though.
Mm-hmm.
And then it isn't like they're going to throw away the mammogram in the future. We're not saying that the MRI is the better tool. It's still going to be a mammogram. You'll just alternate it. So it's usually like every 6 months. So it'll be a mammogram and then 6 months MRI, mammogram, 6 months MRI.
I think genetic testing has really opened up the testing forefront of women's health. So genetic testing has become increasingly available, not just in the social media platform. There's a lot of 23andMe and Ancestry and those online.
If TikTok says we need it.
If TikTok says we need it, then we must.
100%. If they say you need that test, we're getting it.
We're getting it. So the genetic testing has opened up, I think, people's awareness about inherited cancers within women's health. We pay close attention to inherited breast cancer traits. We look at Lynch syndrome, which increases your risk for ovarian cancer. We look at maybe it's not female cancer. Maybe it's a paternal history of, so the dad's side had pancreatic cancer and prostate cancer and melanoma. Well, even though those don't seem like they'd be linked to female health, they are. We know that those also increase your risk for breast cancer. So it's looking at the genetic testing that a lot of people are doing independently. We also offer in both of our offices hereditary cancer screens. But when people are doing that independently, then they're getting results. I've talked to women that do the 23andMe genetic test and find out they have a BRCA gene, which is higher risk for breast cancer. And so then it's bringing that result to us and saying, what do we do next? And getting them to genetic counseling and talking about their breast screenings and preventative healthcare and what that looks like for them. But I do think that's been an important change, or a big change that we've seen in women's health, is more access and increased use of the genetic testing.
We sit down with you and go through your whole family history, and then your insurance takes that into account. And say your personal insurance doesn't want to pay for that, it's typically no more than $250 out of pocket if you wanted to pursue that on your own.
Which is so much more affordable than what it used to be. Yes. Probably 10 years ago, you were looking at several $1,000s. Yeah. So
really,
for $250 to figure out where your breast cancer risk is, or your ovarian cancer risk.
I have a strong family history of a brother with pancreatic cancer. My mom had a brain tumor. I had an aunt with melanoma. My dad had Parkinson's. And for some reason at the time, years ago, they weren't in contract with my insurance, but I didn't care. So I went ahead and did it. And it was only $400. I've wasted $400 on many of the things.
Yeah.
I mean, this was a great peace of mind to know that all that came back, that I didn't have a gene for one of those.
And that is a national, or is that a Wyandot Memorial price?
I think that's just what the company
It's the company. It's
offers.
Not our price.
Yeah.
It's not the hospital.
That's just their cash price.
That's really nice that it is a smaller nominal fee. And I'm sure, and I should have done some research before I started to say this, but I'm sure there has to be some type of program for assistance for maybe those lower income families that don't have the $250. You know, all of us in this room here are thankful, grateful, and blessed that we could pay the $400.
And it's actually very rare that someone has to pay it.
Yeah, really. Primarily insurance. And it's becoming more and more affordable and accessible. So insurance companies are covering it better. Also, we do our best in the office to justify it to your insurance company. Mm-hmm. This is a necessary thing that we feel is pertinent to their medical care. So we will try to work on, advocate for you that this is something that you need. The company that we're currently linked with, they offer financial programs for patients as well. That if you really truly can't afford that, then we reach out to our representative to that that company, and they work their magic.
That's awesome. You know, it's all about partnerships and putting the right people in place to be able to make those connections. I'm going to do a hard turn, okay? Because I should have asked this at the beginning. One of the elephants in the room within the community is that we closed our OB department. So as we closed OB, can we reassure the community that we still provide OBGYN care? We just don't specifically deliver babies here, correct?
Yeah. So I had not worked here maybe 6 months when the decision was made to close the unit and kind of reroute what that looked like for us. And we teamed up with Tiff and Mercy, and we've established great relationships with the other midwives and the physicians that we work with there. We work with Dr. Hedges and Dr. Doty, and they have some locum coverage. And then some of the other midwives that we work well with them. They're very supportive of us. Initially, we were figuring out, like, how is this going to work and what does call look like? And we have made some changes. We've made transitions within our department just for what is best for us in this phase of life, in this situation where Susan and I are. And we do still offer full OB antepartum care. So while you are pregnant, we provide full care for you. And we both love that. That's a great part of our job, is getting to walk with women during that time and support them, answer their questions, reassure them, again, get them the resources they need. And then the team at Tiffin is managing the delivery component. So they're great providers. We trust them. There's several midwives plus the physician coverage. We've had nothing but personal great experiences with their providers. And so they cover the delivery component. And with Dr. Doty working with Susan and I closely, most of the women that we care for are able to meet her during the pregnancy, get to know her a little bit. And then once they deliver, they come back to us and we make sure that we take care of them in the postnatal period.
Yep. And we can honestly say that we know them very well as practitioners because we worked alongside of them for
years.
3 or 4 years.
Yeah.
And there's not one of them that I wouldn't send my own family member to. If they happen to be on call, I always feel good telling all my patients that. Some of them trained where I trained. Some of them, I trained them.
Yeah.
And we work with Dr. Doty and we know what she's about. And I'm always happy to say that I feel that my patients are in safe hands. I don't have to worry about who they might happen to catch when they go in labor.
It's nice to have that connection with Tiff and Mercy, that it is just right down the road, 22 minutes down the road, that it's not too far away from our facility. And so we are able to refer somebody to a facility that we recommend and that we trust, and we making sure that our patients are receiving the best care possible.
And it's a beautiful department.
It's brand new, right?
Yes.
They just expanded. They added more beds because they have been growing as a unit by the numbers every year. And so they just added more beds to the floor, and they're expanding nursing staff, and they offer really great things. And something that I thought was really cool coming into Tiffin was they offer nitrous gas for labor management. So if you don't really want medicine through your IV and you don't want an epidural, they offer what's essentially like laughing gas as a pain management tool. And not every facility offers that. They have a labor tub, so a really nice jacuzzi tub that if women want to labor, I think that's a great option that they have there. I think it was a hard decision for Wyandot. I can't imagine being in that boardroom and having those conversations and ultimately making that choice and knowing that it was going to upset a community. I think it was a move that put our department well aligned with Tiff and Mercy. I don't think it was backward steps for our department. I think it was forward movement. I think we've had a good experience. I personally had my last baby. Susan took care of me prenatally, and then I delivered up at Tiffin, had a great experience. The nurses were awesome. I was able to have another midwife in the room with us just to celebrate birth. And I think that's something that you don't get everywhere, that one-to-one care.
One thing I am impressed with Tiff and Mercy, and tell me, Megan, if you don't agree, those nurses take great pride in keeping their education up on laboring patients.
Oh, it's
that
incredible.
Patient does not lay in that bed and they're not just hooked up to a monitor and checked on periodically.
A lot of the girls take this class. It's called spinning babies. And it's a way to get the baby into a better position while you're laboring. So it's not just laying on your back in the bed with your epidural. They've got you on a ball, turned sideways with your leg up on this. Like they get those.
And at any given
moving.
time, there's a couple of them and they're consulting. I'm thinking, according to this exam, she would benefit if we did this or that.
Yeah,
and it works. It really works.
It does.
As we start to come to an end, one of the last things I want to talk about is what kind of advice would you give to a woman who hasn't had an annual exam in years, but is looking to get back on track with her health? So Susan, what's some advice that you could give to somebody that's looking to get back?
You just got to do it. You just got to make the phone call. We can always fit you in. And if you're thinking that I need to get this done, don't worry that we're going to push you way out on the schedule. If you're having a problem, we both have same day visits. If you're having anxiety about coming, just call and make the appointment. Get it done. We'll get you in quick before you start getting stressed out about it. I always joke when my patients say, oh, I hate to come here. I hate to get a pelvic exam. I hate to have to get undressed. I'm always so embarrassed. I always joke and say, I always personally cancel my appointment 3 times. I mean, we get it.
Yeah.
We don't like to go to get this kind of, it's not like somebody's just looking in our ear, it's like not something you look forward to, but it, goes back to just like what we talked about with the mammogram. Once in a while you don't have good outcomes and you get some bad news, but man, it feels good to know that check, everything looked good. I had a good, clean physical and I can get that off my brain and my list of things to worry about.
I think sometimes it can feel overwhelming. If you haven't been to the provider, say I'm hypothetical here, 6 years. I haven't seen anybody for 6 years and I know I'm overweight. I know that I haven't had my cholesterol checked. I know that my parents are both diabetic. My grandparents are diabetic. I'm probably diabetic. I haven't had a pap smear and what if my pap's abnormal? I haven't had a mammogram. And there can be a lot of like what that person feels is shame. Like, man, I haven't done any of this stuff. I haven't been taking care of myself, and taking that first step is going to be so hard. And it really truly is. Take that first step, make the appointment, and then we tackle the other things. Then we talk about what your mammogram looks like. Then we talk about what your pap smear looks like. It's just, and we don't want you to feel overwhelmed that I have all these things that need fixed. Yeah, maybe you have all these things that we can work on and we can improve, but none of it's perfect. No one's perfect. It's making that appointment, taking that first step, and really, truly having the courage and the bravery to make that phone call counts for a lot. And I really think I speak for both of our offices when you come up to the window, it's a happy face that you meet. You feel warm and greeted just from the start. And then you come back and there's laughter, there's light, there's softness. Like, I really think that we try to create an environment for the women. We don't want you to feel shame. We don't want you to feel anxious about your visit. We want you to feel comfortable. And I think people are surprised when they come to our offices how comfortable it is. I laugh a lot of times. People, like when I'm walking out of the room, they say like, thank you. And I'll be like, well, you don't mean it. Like, like most of the time people aren't actually like having a great time to say thank you. But I think that it represents a connection. It represents a relationship. And I think that counts for a lot.
Yeah, I wish I had a nickel for every time after an exam and somebody has been so anxious about coming and then the exam's over and they walk out and they go, that wasn't so bad. Yes. I was so worked up about this for so long. I can't believe I put this off.
Specifically pap smears. Doing the pap smear component of it, people get really, really anxious. And if I can see you wringing your hands and you're getting hot and everybody's sweaty during an exam, that's what it is. You're naked on a table. Nobody wants to be naked on the table. So everybody gets hot. And so then they're like, I'm sorry. I'm so sweaty. I'm sorry. Hey, you're nervous. I get it. You know what? That's what every single woman is doing when they're on this table. Everybody's in the same spot. We're so similar in that way. And it is such a vulnerable exam that to sit there, and we do our best to get into the rooms quick, but sometimes we get held up with a phone call or a consultation or something. And that's really challenging, but we try to do our best to get in there, ease your anxiety. And then you walk out feeling, okay, that wasn't that bad. And the more regular that becomes, so you start showing up for your annual because you feel comfortable with your provider, then you're getting more good news, more good news, more good news. It feels more comfortable. It's part of your routine. Then you get less anxiety, because you have expectations of what that's going to bring.
And we're not rookies. There's nothing you're going to say that's going to shock us.
There is no shock value. People will always preface stuff with, this might be TMI. I'm like, honey, you're in a gynecology office. No such thing.
That's great. Is there anything you'd like to leave us with before we end?
Yes, there's been some new guideline changes on colonoscopies, and the previous age to start getting your colonoscopies was age 50, and now it's age 45, because we were finding that when people showed up at age 50 to get their colonoscopy, we were already finding cancers. So we're hoping to start doing them earlier and finding things before they turn into a cancer and get rid of them and save people's lives. And we have a great GI team here at Wyandot Memorial Hospital. I honestly don't even know how we got so lucky to get such a great team to such a small little hospital. And then we have 2 general surgeons that also do screening colonoscopies, Dr. Valley and Dr. Shermer. And I've always brought that up at every GYN physical to make sure, is your ma'am up to date? When have you had your colonoscopy? And when we call over to the office, they get them in right away.
They're very quick.
Yep. Another thing to be able to put off your checklist of stressing out about. And everyone likes to tell a good story. Everyone has a bad colonoscopy story, and it's always about the prep. And the prep is nothing. I'm guilty. Not only do I cancel my pap smear 3 times in a row before I finally go, I put off my own colonoscopy. And everybody said, oh, it's terrible. It's terrible. It was nothing. I mean, you just take the prep, you show up, and they start an IV. And next thing you know, they're saying, wake up.
I think we try to encourage people. Both of us hand out, we keep them in the office. The health fair vouchers that Wyandot offers is a huge service that we try to get our ladies to take advantage of, where they can get, sometimes your insurance, it covers some labs, but you might have a deductible or a high out-of-pocket expense. So we can give you a voucher for health fair. It used to be a while back that it was only specific days. Now it's anytime the lab is open, you're able to use the health screening, and it includes, you can get your lipid panel done, you can get your thyroid testing, you can check your white blood cells, red blood cells, kidney function, liver function. It's a great service that we offer that we also try to encourage, if they're not with a primary care provider and they're not doing annual lab work, to check it out.
Another thing is, at different phases in our lives, one of the things I wanted to talk about is how the needs of a 20-year-old's physical is different than a 50-year-old's physical. And it always shocks me when someone shows up for their physical and they're 50 years old, and some of the symptoms that they've put up with forever, and they finally, break down and come into the office. And it's sad because we could have fixed this years ago, and people don't have to live with a lot of GYN problems that we put up with because we just think that you don't want to talk about it, or you don't want to have to get undressed, and there's a simple fix for it.
And sometimes that's societal or cultural too, where you're kind of like, your mom didn't talk about it to you, or your grandma doesn't talk about it. And so you don't talk about it. You just suffer through. And we hate to see that when there's something easy or simple or pretty straightforward that we can do to help. I love that we have the mental health crew here now. That's great. Having Belinda and Tiffany and Dr. Zara available has been hugely beneficial. I would say the majority of my day is spent talking about mental health in a roundabout way. Maybe we're talking about a physical symptom, but when we get to the root of it, we're talking about maybe anxiety or depression or some different emotional stuff that women experience, and no one's alone. We're all going through it to some degree. And I think that's been a huge service that we've been glad to take advantage of.
Yep. It's no mystery that the mind and the body are connected.
Yeah.
Well, Susan and Megan, thank you so much for taking time with us today, dealing with some of the questions that I had specifically, but also you've reassured me again that we are continuing to offer the highest quality of care to our patients every single time. So thank you both for coming here and talking about this, and I appreciate you.
Thank you.
We hope you enjoyed our conversation with Megan, Bair, and Susan Hotelling. Their dedication to women's health truly highlights the exceptional services available at Wyandot Memorial Hospital. Women's health is about nurturing your body and prioritizing overall wellness at every stage of life. Regular checkups, preventative care, and seeking medical advice when needed are essential to maintaining good health. If you or somebody you know is in need of expert care, the women's health professionals at Wyandot Memorial Hospital are here to provide the support and services you deserve. Thank you for joining us today. We look forward to bringing you more stories and insights from our incredible team of medical providers in future episodes. Until next time, stay healthy, stay informed, and take care of each other.
The secrets you should know.